Okay, you have class on PSM practicals, but I will take your PSM theory on the topic of delivery of healthcare system. Write down the topic delivery of healthcare system. PSM theory. ঠিক আছে? PSM theory topic to হয় delivery of healthcare system. Delivery of healthcare system. Let me share with you the screen. 1 minute, okay? Are you able to see the screen?
Yes, ma'am.
Okay, delivery of healthcare system. Itu mane PSM theory hoy. Okay, we have already completed most of our topics. ঠিক আছে আৰু আমাৰ hardly এটা দুটা ক্লাসে থাকিব. So you just write down delivery of healthcare system. So in delivery of healthcare system, it is mainly about the healthcare services. It can be NGOs, it can be public hospital, private hospital, government hospital. Okay, so we will study about those things in delivery of health care, mainly related to hospital. So health services are designed to meet the health needs of the community through the use of available knowledge and resources. Without knowledge, you cannot assist a patient. Okay, with little knowledge, you cannot assist a patient. You should be a very skillful person. Even if you are studying DMLT, okay, medical lab, so you should be well aware about the things that are present in laboratory, how to deal with the instruments, how to deal with the patients. So you have to know all these things with little bit of knowledge. Patient, because we are human beings. Okay, you are not dealing with animals, but you are dealing with live human beings. So you should be very much careful when you work in a hospital. And resources money in hospitals, what things are required? Without saline, without injections, okay, without bed sheets, okay, without doctors, without nurses, without the technicians, be it radiography or else medical lab, DDIT, dialysis, okay, without all of these things, without medicines, without cannula, whatever things are there required in a hospital setting, if all those things are not present in a hospital, then you won't be able to give proper care to the patient. Okay, so knowledge and resources, it goes hand to hand. Both these things are equally important. Okay, it is not possible to define a fixed role for health services with the socio-economic pattern of our country differ so much from another. Means the health services that are present in a developing country and in an underdeveloped country and in an already developed country are very, very different from each other. Okay, the resources that are present in developed countries, you won't get all of those things in a developing country. Like in India, most of the things are still not available. Okay, and most of the things are already available in many parts of the country that are already developed. So we cannot compare these two things, and there are lots of things that needs to be done. Okay, the health services are delivered by the health system, which constitutes the management sector and involves organizational matters. Be it an institutions hub, be it a hospital, it always needs a management sector. A person or a group of people that will manage the whole thing. If it is a private sector, then there will be a organization, okay, that will be running the hospital. If it is For example, downtown hospital, downtown university or downtown hospital. So even in this is a private sector, but it is run by a group of organization. Okay, there is a management committee. So all these things, without this thing, you will not be able to run a proper health sector. Okay, so this is the meaning of delivery of health care. You please write down this. তাৰপিছত healthcare delivery. So healthcare delivery ইয়াত you please draw this model. Itu eta simple model hoy health status or health problems. Okay, and here is resources, means whatever resources are required to run a hospital. Curative. Okay, curative means, what is curative? Curative means to cure. Okay, to cure any kinds of disease, any kind of infection, any kind of illness. Okay, you need a proper resource. Curative. Preventive means to prevent. Curative means to cure. If you are having fever, then what you will do? You will take medicine that can heal fever. For example, you will take paracetamol so that you can cure yourself. Preventive mane the things that you already took, okay, to prevent from any kind of disease or infection or illness. It is known as preventive medicine. Are in preventive, for example, polio vaccine, TT, BCG, hepatitis B. Okay, so all these things, why do we take? So as to prevent from various kinds of diseases, infection or illness. Promotive means to promote our social well-being, to promote well-being of the well-being or good health of the people or public as a whole. And then there is public sector, private sector, voluntary sector. Voluntary sector mane, for example, your NGOs. Okay, NGOs, then Red Cross Society. Okay, then BSS, there is Bharat Sevak Samaj. So all these are all voluntary agencies. Next is your indigenous. And lastly, all these things together will lead to changes in health status of a person, of an individual, of a victim, or a person as a whole. So this is a simple model of healthcare system. Please write down this. Finish whole ne? Have you finished writing?
नहीं हो मैं
जल्दी लिखा.
Finish, ma'am.
Holne, finish?
Yes, ma'am.
Finish?
Yes.
Episode, write down this healthcare system. In healthcare system, these are divided into public health sector. In public health sector, there will be primary health care, okay, or primary health centers. There will be sub centers, especially in the rural areas. Okay, then hospitals, health centers, community health centers, rural hospital, district hospital, specialist hospital, teaching hospitals. Okay, teaching hospital means that money you will be able to study also, and also there will be patient care. For example, GMCH, Guwahati Medical College and Hospital. So Guwahati Medical College and Hospital is also a teaching platform, plus also it gives care to the people. Both hospital are, it's a teaching sector. Episode, even your downtown also, there is downtown university for learning purpose, teaching purpose, and there is downtown hospital for practicing. Okay, and also patient care is available in that hospital. So this is known as teaching hospital. Okay, specialist hospital means there will be different all the equipments, various kinds of equipments will be present there. For example, Ayur Sundra Hospital. Okay, Ayur Sundra Hospital near Lokra, then all those are also specialist hospitals. Next are health insurance schemes, then employees state insurance, then central government health schemes. So all these are schemes that is being given by the government. Next is other agencies, that is defense, service, railways. Okay, so all this comes under your public health sector. Public means as a whole. Next, private sector. Private means tomorrow nursing home, dispensary, polyclinics, ebu shop. All these are private hospitals. Okay, comes under the private sector. Next, general practitioners and clinics. Okay, clinics, small clinics. All these are all the private sector. Indigenous system means Ayurveda, Unani, homeopathy, unregistered practitioners. Okay, all this comes under your indigenous system of medicine, and all this Ayurveda, Unani and all we have already discussed in the in unit 1. Okay, and voluntary I already told you, NGO, okay, Red Cross, all this comes under voluntary. Next comes your national health programs. In the national health programs, there are certain programs that has been given by the organizations. For example, WHO. Okay. And this and unregistered practitioners money, all those people who are not registered by the council. Okay, if it is nurses, then if you are not registered with the state nursing council, then you will be called as an unregistered practitioner. Even for DMLT, for medical lab, or any other DDIT, DRT, anything, you always need to be a registered practitioner. Then only you can work voluntarily. Okay, otherwise you will be called as an unregistered practitioner. So actually you can write down, or else you can take the screenshot. You all are writing or taking the screenshot?
I'm taking a screenshot.
Screenshot, no. Yes, sir. Finish taking all this?
Yeah, ma'am.
Last page नहीं हुआ.
Last page. Itu.
मैम एकदम लास्ट
Last. Whole? Okay. তাৰপিছত
মেম হোৱা নাই মেম
মেম
Hmm.
আপুনি যে এইটো কি বুলি ক'লে আনৰেজিষ্টাৰ্ড
Practitioner.
প্ৰেক্টিচন নে কি বুলি ক'লে যে
Hmm.
মানে পিছত ধৰি লওক আমিও পিছত এনেকে কৰিব লাগিব নেকি?
এইটো মানে তোমাৰ মতে এতিয়া ডাউনটাউন ইয়াত কৰি আছে ন, সো ইয়াৰ পৰা সব কৰাই দিব হ'ব লাষ্টত। এতিয়া নহয়, টাইম আছে। আৰু এইটো ৰেজিষ্ট্ৰেচনটো স্পেচিয়েলি নাৰ্ছেছ আৰু ডক্টৰছৰ কাৰণে বেছি ইম্পৰ্টেণ্ট হয়। আৰু তোমালোকৰ কাৰণেও কিবা ৰেজিষ্ট্ৰেচন দিবই ইয়াৰ পৰা কিন্তু।
মেম পেজটো অলপ ওপৰত দিয়কচোন মেম তলত মেম আৰু তলত মেম আৰু নাই ন
Hmm?
আৰু নাই
আচ্ছা ঠিক আছে। Now write down the functions of PHC. Okay, primary health care. Primary PHC মানে primary health care. The functions of primary health care কি কি আছে? There are 8 functions are there. Okay, they are medical care, then MCH including family planning. MCH মানে mother and child health. Okay, mother and child health mane at the time of pregnancy the mother should be given proper care. They should visit the doctors. Okay, they should go for regular checkup. They should take iron tablets. Okay, so all of these things it will be done. And then including family planning. Family planning now the government has also implemented hum do hamare do, means only 2 child. Okay, then safe water supply. Okay, then basic sanitation, prevention of endemic diseases. Okay, next comes your collecting and reporting of vital statistics. Vital statistics mane tumar heri mortality and morbidity. We have studied na mortality and morbidity, so all those things are also comes under your vital statistics. Then national health programs as relevant. Okay, as relevant. Don't write this as relevant. National health programs. Then next is a referral services that will be in the rural areas. Then there will be training of health guides, health workers, local dyes, and health assistant. Last is basic laboratory services. Local dyes means all those local dyes are the women who are working in especially rural areas in villages. Okay, they are not they are not even nurses, they are not even health professionals, but because of their experience in delivery, because of their experience in delivery, they used to perform all of these things on their own knowledge, on their own risk. Okay, so all these local dyes, they are not trained, they are not trained peoples. Okay, there are some women, old women especially, they used to perform all this at the time of delivery. They used to perform all of these things on their own risk. So all these are not related to even medical setup. Kintu these days, like the government has also implemented that all these local dyes also they should be given training. Okay, because most of the people they goes to this local dyes, especially in rural areas or villages. So here the government has implemented that they will also have to undergo training. Okay, and they need certificates also. They will also get certificates. It might be 2-3 months training that they have to undergo, and then only they can perform all this delivery of the babies. Otherwise it is very risky. Okay, without training they used to perform all of these things. Okay. ঠিক আছে মই তোমাৰ I will give you this PDF in হেৰি in your group. Okay. মই
Ma'am,
PDF
ma'am.
পঠাই দিম. Okay.
Ma'am.
Hmm.
Hello, ma'am.
Hmm.
Ma'am, আপুনি যে হাইজিনৰ যে এইটো দিছিলে ইউনিক
Hmm.
টপিকটো
Hmm.
মেম মানে মই স্ক্ৰীনশ্বট লৈছিলো স্ক্ৰীনশ্বট লোৱাতে ক্লিয়াৰ নহলে মেম মই এতিয়া মানে
ঠিক আছে
লিখিব
মই
পৰা
PDF টো পঠাই দিম.
মেম হাইজিনৰ PDF টো দি দিবচোন
ঠিক আছে.
অ
So এইটো হয় তোমাৰ immunization schedule. Okay, national immunization schedule for infants, children and pregnant women of India. Okay, these are the vaccines. This is when to give, how much dose to give, where you should give, and the site. TT, tetanus toxoid. Okay, TT. TT1 is given early in pregnancy. Okay, and the dose is only 0.5 ml intramuscularly on the upper arm, upside of your arm. Okay, it will be given in your muscles intramuscularly. Muscularly mean in your muscles. Okay, only 0.5 ml dia jabo to early in pregnancy to women. Then TT2 will be given after TT1, after 4 weeks after TT1. Second dose of TT will be given to the mother. That is same 0.5 ml in the muscle area intramuscularly. Lastly, TT booster dose dia jabo. TT booster, it will be given if received 2 TT doses in a pregnancy within the last 3 years. Last 3 bosor, that time this TT booster dose will be given to the mother. Okay, same 0.5 ml. For infants, BCG. BCG is Bacillus calmette-guerin. Okay, write down the full form of BCG. Likhasun, full form of BCG. Bacilli, BACILLE. BACILLE. Bacilli. Just ito likhasun, just full form of BCG likha. I can ask you on multiple choice also as fill in the blanks. Okay, so BCG likha. Bacilli, BACILLE. Bacilli calmette-guerin. Calmette, CALMETTE. CALMETTE. Calmette-guerin. GUERIN. GUERIN. Bacilli calmette-guerin. It is the name of a vaccine that
Ma'am,
is
Bacillin to Bacillin spelling to
Bacilli. BACILLE. BACILLE. Bacilli calmette-guerin. CALMETT. Calmette-guerin. GUERIN. So BCG vaccine is given to prevent tuberculosis, TB. Hunisane TB? Do you know TB? Have you heard tuberculosis?
Yes, ma'am.
Yes, ma'am.
What is it?
मैं तो पानी स्टोर हो जाए बुकुट
Pani store? Huh? কোৱা ভালকে কোৱা। TB to এটা airborne disease hoy. Okay, and it mainly affects your upper respiratory tract. Upper respiratory tract mane mainly tumar lungs. Okay, the person will cough for more than jodi 2 weeks. Okay, more than 2 weeks or 1 week. More than 1 week to 2 weeks, if a person coughs daily, then the person is suffering from TB, that is known as tuberculosis. Okay, and this tuberculosis can be spread from one person to another. So jodi if any person is suffering from tuberculosis, you should always cover your mouth with a handkerchief. Okay, because it is a communicable disease. Tumar heart disease, kidney disease, ebur non communicable hoy. Okay, it doesn't spread from one person to another. Into all this TB, cough, okay, measles, all these are communicable disease. So you should take proper care. Preventive measures should be taken. Okay, and sometimes with cough, there might be expulsion of blood. Okay, blood with mucus is also a symptom of TB. The person will be breathless. He or she will not be able to take breathing properly. Okay, respiratory distress. So these are some of the symptoms of tuberculosis. So to prevent tuberculosis, when the person is an infant at birth, okay, as soon as the baby is born, or as early as possible till 1 year of age. Within 1 year, ek bosor hoar agote, you should give BCG vaccine to the baby, and the dose is 0.1 ml, both com. Okay, 0.1 ml intradermally in the left upper arm. Intradermally means just below your skin. Tumar just chamur okhoman bitor, that is known as intradermal. Muscular means pura muscles. Okay, pura inside. Basic okhoman basic humab lage, kintu intradermally means just little bit slide. So it should be given in the upper arm, that is in the left side. Right side of nohoy, in the left upper arm. This BCG vaccine should be given to the baby. Then hepatitis B vaccine. Okay, same. It should be given at birth or as early as 24 hours. Within 24 hours, the baby should be given hepatitis B vaccine. Then OPV is your oral polio vaccine. So oral polio vaccine 1, or oral polio vaccine 2, oral polio vaccine 3. It should be given, first dose should be given at 6 weeks after the baby is born. Second dose 10 weeks. Third dose 14 weeks. Only 2 drops orally. Orally means in the mouth, inside the mouth. Okay, only 2 drops should be given. Then your then next is your DPT. Okay, write down full form of DPT. You write down the full form of DPT. D likha or write a dash dia and write down. D is for diphtheria. DIPHTHERIA, diphtheria. Diphtheria. DIPHTHERIA, diphtheria. P likha, number 2 likha P. Full form of P is pertussis. PERTUSSIS, pertussis. PERTUSSIS, pertussis. Last likha T. T is tetanus. TETANUS.
मैम P2 आपको एक बार कोक ना
Huh? D.
मैम P2 PP
Pertussis, PERTUSSIS, pertussis.
थैंक यू मैम
So DPT first dose, DPT second dose, DPT 3 dose. It is a combination of 3 infectious disease. Okay, D is for diphtheria, P pertussis, T is for tetanus. So for these 3 vaccine, it's a combination of 3 vaccines. Medicine, it will be only one medicine, but it is a combination of 3. Okay, so same 6 weeks or 10 weeks and 14 weeks. It should be given in the muscles, intramuscularly, in the thigh, in the mid thigh. Okay, in your thigh, 0.5 ml. It should be given as early as possible. Next is your hepatitis B 1, 2, and 3. First dose, second dose, third dose, same 0.5 mid thigh. Next is your measles, then vitamin A dose orally. Orally means inside the mouth at 9 months, along with measles vaccine. Next is for children, DPT booster. Okay, after the third dose, booster dose will be given at 16 to 24 months. Then OPV booster, OPV 1, 2, 3. After that, booster dose will be given same 16 to 24 months. Then measles or first dose it was at 9 months. Next, again, second dose will be given at 16 to 24 months. Next is JE. Okay, it is Japanese encephalitis is mainly spread through mosquitoes. Okay, so this will be given 16 to 24 months along with DPT and OPV. So all these three will be given together. Last is vitamin A. Second to 9 dose will be given at 16 months. Okay, till the age of 5 years. DPT booster 5 to 6 years, and TT lastly 10 years and 16 years. Okay, our meeting time also is getting over, so I will end the class here. So all these things I will give you in your WhatsApp. Okay, I will make a PDF and I'll send it to you in your group. Okay, okay then, thank you.
Thank you, ma'am.
Thank you.
Thank you, ma'am.
Thank you, ma'am.